Need help billing in Sessions Health or Therapy Notes? We can help. Medical Billing Professionals is an approved Sessions Health billing partner. We also are an experienced billing service for Therapy Notes practices, serving over 65 Therapy Notes practices. Do you have to use Sessions Health or Therapy Notes to use our mental health billing service? It is important to stress that providers do not have to be using Sessions Health or Therapy Notes or any EMR in order to use our mental health billing service. We have easy online forms providers can complete to provide patient demographics or billing. In addition, we can work with other EMRs like Simple Practice, Valent, Tebra, IconNotes, and Practice Fusion to bill in our Metasoft software. If you are using any other EMRs, you can export patient demographics and billing to provide to us. Now, not all practices require the same level of service with medical billing professionals. Therefore, providers should only pay for those services that they need. We offer for Sessions Health and Therapy Notes users 2 different levels of service, Platinum and Premium Plus. With the Platinum service, we can handle all billing responsibilities in your EHR, setting up new patients, verification of insurance benefits, claim submission, payment posting, follow-up of denied claims, and a revenue report upon request. Now, setting up new patients in Sessions Health or Therapy Notes. The biggest problem with rejected claims for Sessions Health or Therapy Notes users is not setting up the patients correctly. For example, maybe you entered the wrong insurance payer or the wrong ID number. For any new patients, you have 3 options if using our service. You can set up all new patients yourself in your EHR. If you are using the patient portal in Therapy Notes, on a daily basis, we can download the client insurance form completed by your patients. If you are using the patient portal in Sessions Health, you can advise us when a patient has completed the client insurance form, or you can provide us administrator access so we can review the forms ourselves. Or the third option, you can complete a simple, secure online form on our website. We will then accurately set up the patient in your EHR. If you choose this third option, you can still set up the patient with basic demographics such as name and date of birth, so you can schedule the patient. It is highly recommended that you upload a scanned copy, front and back, of the patient's insurance card into your EHR. If you are using the patient portal, you can require your patients to scan a copy of their insurance card, front and back, when completing the intake paperwork in the portal. For any new patients or for patients who change insurance, we will verify eligibility and benefits. We will enter the information on the Billing Settings tab for the patient in Therapy Notes or under the client information in Sessions Health. Information entered will include the effective date, the deductible, including amount remaining, any copayment or coinsurance, any out-of-pocket maximum, including amount remaining, if claims go to a third-party payer like Carelon Behavioral Health or Magellan, if a prior authorization or a referral is required. In addition, if you need to know if a specific CPT code is covered, such as 90847 or psych testing codes, let us know in advance. Benefit information is entered in your EHR by the next business day. There is a limit of 3 verifications per day and 60 per billing month. There is an $11.95 fee for each additional verification above 60 during a billing month. Now, for existing patients with the same insurance since the last visit, we do offer an optional verification service. This service is designed primarily to see if a patient's benefits have changed for a new benefit year, or if a patient has met his or her deductible or out-of-pocket max for the year. You would have to complete a simple form on our website requesting that we verify the benefits for this existing patient, and you understand the fee for this optional service. On a daily basis, we will log into your EHR and submit your claims ready to submit electronic and paper. We will review any claims that may have rejected electronically. If we are able to determine the reason for the rejection, we will correct and resubmit. If we require your assistance, for example, the claim denied because the patient's coverage terminated, we will securely notify you of this so you can provide us corrected information. For EAP billing, we are able to submit those claims to payers that allow electronic submission, such as Optum and Cigna. For payers like Magellan or Carillon that require EAP claims to be submitted via their specific online forms, providers will submit these forms themselves because of the requirement for clinical information. We would recommend for United and Cigna, if you do EAP work, that we set up separate EAP payers, such as Cigna EAP and United Healthcare EAP, because of the payer-specific requirements for EAP billing. For secondary claim submission, we will submit any secondary claims to payers if not crossed over by the primary payer. If the patient has Medicare as primary, there's a good chance that Medicare has auto-crossed over the secondary claim. If they have not, we will go ahead and bill the secondary claim. We will submit the secondary claim electronically in your EHR if allowed by the payer. However, it's important to note in TherapyNotes, you can only submit secondary claims electronically if the insurance payment from the primary payer is via electronic remittance advice. This is one flaw of TherapyNotes regarding secondary billing. We will submit secondary claims on paper with a copy of the primary payer EOB if we are unable to submit the secondary claims electronically. For payment posting, we will ensure your office is enrolled with all possible payers to receive electronic remittance advice, electronic EOBs, in Sessions Health or TherapyNotes. If you are a TherapyNotes user, on a daily basis, when we log into your TherapyNotes account, we will post all ERA files. Prior to posting, we will review the ERA for any claims that denied. For claims that may have denied an error, or where we cannot determine why the claim denied, we will automatically follow up with the payer if you are enrolled for our Platinum service. For claims that denied because coverage terminated or eligibility was not found, we will notify you to provide us corrected or updated insurance information so we can resubmit. For Sessions Health users, on a daily basis, we will review the remittance reports for the ERAs auto-posted by Sessions Health and again follow up where needed for those claims that denied, again assuming you are enrolled for our Platinum service. For any EOBs you receive in the mail, you will scan the EOBs you receive that are not also found under ERA and TherapyNotes or under your remittance reports in Sessions Health and securely upload them to our website. We will manually post these EOBs in your EHR. Your office can easily post your patient payments yourself. However, if you want us to post them for you, we can do that. Assuming your office is enrolled for our Platinum service, follow-up of outstanding or denied claims that we have submitted is included in this level of service. So for any primary insurance claims we have submitted, when we post EOBs from payers, if a claim rejects an error or we cannot determine from the EOB why the claim rejected, we will automatically follow up with the payer. Again, for any claims that we have submitted that are primary insurance claims that remain outstanding more than 30 days after claim submission, we will automatically follow up with the payer. If after speaking with the payer, we require additional information from you, such as notes or corrected patient demographics, we will securely notify you. At least once a week, and preferably every day, your office must provide us copies of EOBs you receive that are not found under remittance reports in Sessions Health or under ERAs and TherapyNotes. For any older claims that your office submitted on your own or submitted via another billing service, we offer an on-demand follow-up service that is optional. With this service, you can complete a simple form online requesting that we follow up on the older claims. A fee of $12.95 per follow-up claim applies just for these older claims that you request that we follow up upon. Do you pay your clinicians a percentage of the amount paid by insurance? If so, you are probably using the revenue report in TherapyNotes or Sessions Health. But are you aware the revenue report in TherapyNotes is flawed as it is based upon the date of the payment? This can cause problems. For example, if on Saturday the 15th, we run a report for the week that ends on Friday the 14th, and then on Monday the 17th, we post a payment from a payer with a payment date of Friday the 14th, that payment is lost for revenue report purposes. If we know you will be using the revenue report in TherapyNotes, the way we get around this is by changing the payment date. In the above example, for the payment received on Monday the 17th, to ensure that payment is reflected on the next revenue report, we would change the payment date when posting in TherapyNotes from Friday the 14th to Monday the 17th. For Sessions Health users, Sessions Health actually uses the date of posting the ERA as the date of payment rather than the actual date of the payment, so you do not have the problem that TherapyNotes users encounter. Our Premium Plus service is a lower level of service, and you can save some money. Again, we set up new patients, we will review and submit all claims, we submit all secondary claims, we review and post all EOBs, but verification of insurance benefits is optional for $11.95 per verification. Follow-up of outstanding claims is via our on-demand follow-up service. You request what claims we follow up upon, and it's $12.95 per claim we have to follow up upon. We will notify you, though, of all claims that deny in error and require follow-up. For the Platinum service, there is no setup fee. The standard per claim rate is $3.99 per claim, with a minimum fee of $199.95 per month. A 1,000 claim annual prepayment option is $3.65 per claim. A 2,000 claim annual prepayment option is $3.35 per claim. With the annual prepayment option, the number of claims purchased must be used within 1 year. For the Premium Plus service, the standard rate is $2.89 per claim, with a minimum fee of $99.95 per month. A 1,000 claim prepayment option is $2.59 per claim. A 2,500 claim prepayment option is $2.19 per claim. Again, the number of claims purchased must be used within 1 year. And remember, under the Premium Plus service, insurance verifications and follow-up are optional services. Again, no setup fee applies. Are you using a billing service charging a percentage? If so, you are probably overpaying. Most billing services charge between 5 to 10% of the amount paid, with the average being 7%. If you are paying 7% and your average reimbursement is $80 per visit, you are paying $5.60 per claim. Compare that to our highest fee of $3.99 per claim for our Platinum service standard rate. If your average reimbursement per visit is more than $80, your savings by using NB Pros is even greater. For example, if your average reimbursement is $120 per visit, you would pay $8.40 per visit to a billing service charging 7% compared to a maximum of $3.99 per claim with NB Pros. Now, if you group your visits together by patient, you can save. What we mean by this is we're billing on a daily basis. Some providers, though, do their notes every 2 weeks or once a month. And let's just say that on April 15th, we submit one claim for John Smith for April 1st and April 8th. Same procedure codes and diagnosis codes, so they're going on the same claim. So let's assume you're reimbursed $80 per visit for a total of $160. If you paid 7%, you would be paying $11.20 for those 2 visits to another billing service. But if you are enrolled for our Platinum service, you would pay a maximum of $3.99 for that claim. Now, a billing service charging a percentage will argue they fight hard to get your claims paid, but in reality, follow-up is needed on only 2 to 3% of behavioral health claims. If you submit 100 claims during the month, you would be overpaying on the 97 to 98 claims that are processed without any need for follow-up. And to prove this all to you, we have a form, an interactive form on our website at mbpros.com/save. Just complete the fields on the interactive form and you can calculate how much you can save by switching to NB Pros. Now, if you are a Sessions Health user, we have an introductory special for you. Under our standard rate, you will receive the first 2 months free. You will receive 2 months free with our standard rate with a limit of 100 free claims per month. Those are months 3 and 4, not months 1 and 2. So you will receive 2 months free, months 3 and 4, assuming all billing is done inside of Sessions Health. Then for the first year, you're going to save 10% off our standard rate. You will pay only $2.61 per claim for the Premium Plus service, only $3.59 per claim for our Platinum service, and if you're a smaller practice, you're going to save 10% off our minimum monthly fees. If you're submitting 20 or more claims per week on average, you might want to consider our prepayment options. Again, if you purchase a prepayment option at the very beginning, you will receive 2 months free. Again, it will be months 3 and 4. You will save 10% for your initial prepayment purchase. And with the savings of 10%, you'll pay as low as $3.02 per claim for our full service Platinum service, as low as $1.97 per claim for our a la carte Premium Plus service. In addition, we offer free EFT enrollment. So if you want to be paid faster by electronic funds transfer, we offer an optional EFT enrollment service. It's normally $59.95 per payer. However, we offer the first 10 EFT enrollments for free if you request the enrollments within 30 days of signing up with our billing service. Some providers are not signing up for EFTs with Zealous portal because Zealous charges a fee. We can enroll you with the Zealous e-payment center for no fee. And so you're getting paid faster. You're getting electronic remittance advice coming into your EHR. Again, the first 2 are free if you request them within 30 days. If you want details on this entire special offer for Sessions Health users, visit mbpros.com/Sessions Health. Now, what if you're using TherapyNotes? Whether you choose our standard per claim rate or a discounted annual prepayment option, again, you will receive 2 months free, and it will be months 3 and 4, not months 1 and 2. And again, there is a limit of 100 free claims per month. This assumes that all billing will be done inside of TherapyNotes. We do offer the same free EFT enrollment for TherapyNotes users. For details on the special offer for TherapyNotes users, visit mbpros.com/TherapyNotes. That does conclude this webinar. If you're a TherapyNotes user, visit mbpros.com/TherapyNotes for information. If you're a Sessions Health user, visit mbpros.com/Sessions Health. You can email us at info@mbpros.com. If you want to meet virtually one-on-one for us to answer your questions via a Zoom meeting, you can schedule your meeting at mbpros.com/virtual. Remember, you can go to mbpros.com/save to see how much you can save by using us compared to a billing service charging a percentage. And of course, if you want to call us, feel free to call at 877-762-7767. Thank you for watching this webinar.